Women are often afraid of going through menopause. Menopause is when cycles stop. The average age of menopause in America is 51 years old, but what exactly does menopause mean, and what are the symptoms that a woman's going to experience, and what are the treatments? Menopause, this is a picture of a woman's internal anatomy. This is the uterus here, and the white things here are the ovaries. Now, women know that they go through menopause because their cycles stop, and the technical definition is if your cycle stopped for a year, then you're in menopause. But the reason that a woman goes through menopause is because the ovaries, which secrete all the hormones, stop secreting hormones. So that's, in some ways that's good. A woman doesn't have heavy cycles. In some ways that's bad. A woman stops having female hormones, which can cause symptoms. Common symptoms include hot flashes, insomnia, headaches, irritability, not getting along with her husband. What are the treatments? There are a lot of new treatments. First off, not every woman needs to have any kind of treatment. A lot of women that have diets that are rich in vegetables and don't eat a lot of meats and don't eat a lot of dairy. A lot of women don't have any symptoms. In fact, the Chinese didn't have a word for hot flashes 50 years ago because women that had diets rich in soy and didn't eat a lot of meat in China didn't have hot flashes. Now in China, as the country is developing, women have hot flashes, so there is a Chinese word for hot flashes. The new treatments that we use a lot of are bioidentical hormones. There are a lot of synthetic hormones that are made by the pharmaceutical companies, such as Premarin and Provera. These are hormones that have been demonstrated to increase the risk of cancer. The bioidentical hormones are exactly the hormones that are made by a woman's body, by a woman's ovaries. And we can do some laboratory testing and evaluation for symptoms and see whether or not a person needs hormone replacement. And we can deliver those hormones, whether it's in troches that dissolve under the tongue, or whether it's just normal pills, or whether it's pellets or creams that go under the skin. The advantage of these hormones is that it can exactly duplicate what a woman's body was making before her ovaries stopped working, and when that occurs, we're actually alleviating her exact symptoms. The other advantage is that if you're using natural hormones rather than synthetic hormones, it can decrease the risk of cancers and the adverse things that can occur with women that are caused by the synthetic medication. So please come in for evaluation if you're having symptoms either before your periods stop, or as your periods are getting in your 40s, if your periods are getting further and further apart, or if you're bleeding heavier. Come in for evaluation, and there's definitely some therapies that we can do to help you. Thank you.